Definitely going to stay here.
Their chase of perfection doesn't mean that they are less self-confident.
But it does.
Welcome to Bridge the Gap, a show where we aim to build a bridge of understanding between opposing views. Each episode, you'll see our participants sit down to discuss some thought-provoking statements.
The cosmetic industry takes advantage of people's insecurities.
If they disagree with the statement, they'll leave their seat and allow those that agree to explain themselves. Those that disagree then return and express themselves to the rest of the group.
I think most ethical doctors, though, will take a history from a patient. They'll ask them about their social status, their social history.
Hopefully building a bridge of understanding. Let's see what happens.
Cosmetic procedures can be empowering.
Empowering.
Yeah.
I agree.
Definitely going to stay here.
I'd be surprised if you walked away.
I'm happy to start answering that question.
I think you're the best person.
So when cosmetic procedures can be empowering, do I agree or disagree? Yes, I strongly agree with that. I've had so many patients come to me after I've done their treatments to effectively normalize their appearance. For example, someone has they've been bullied at school about their facial appearance. Their nose, for example, may be disproportionately large to their facial features. And they've been bullied at school. They've been bullied by their friends and even their family. I can think of so many examples where my patients have said to me, "I am now moving away from home. I'm moving away from school. I'm going to university in a different town, and I don't want to have the same experience. I don't want people to tell me your nose is too big for your face in the way that they do." And although they may say it in a humorous and amusing manner, it's really not funny. So I've had people say to me, "I'm going to move home, I'm going to move city, and I'm going to start a new life, and I want to just normalize my appearance." And when they come and see me afterwards for their follow-up, 6 months later, 1 year later, they tell me the stories about how they can just function normally in life. People are seeing them for who they are rather than how they appear. So can it empower people when they have cosmetic treatments? For sure it can, and that's mainly because by doing the treatments that we do, we allow people just to get on with their lives and forget about the things that have been causing them problems for much of their adolescence and beyond.
Yeah, I think it can be empowering.
It's quite sad how you say normalize, though, because surely wouldn't it be so much better if everything was accepted the way that people look?
And that's your job. Your job is to change society.
I know, we should start a practice together.
And my job is to make people feel, well, I just want to fit in. And so many people just want to fit in. And you know, if they have something which, if someone has something which falls outside our boundaries of acceptance as a community, as a population, then we can just I can normalize their appearance, and they can just forget about the things that they've lived with for so long, and they can just move on with their lives.
And I think sometimes when you have like a insecurity, you see that insecurity more than anybody else sees that insecurity. It's not really. We amplify our insecurities so much more. If you think about it, sometimes when you've got an insecurity and you say to somebody, "Oh, I want to do this," they're like, "Really?" Or, you know, like, I don't think...
And I think that's right. And I think that's where the disproportionality of their insecurity should match the physical appearance. And if someone has more emotional content to what they don't like in comparison to the physical content, then that's wrong. And it should match. You know, someone, if they're looking to have some treatment done, the way they feel about it should match their physical appearance.
But then what if, always though? All the time?
Yes, because if it's disproportionate, if someone feels really strongly about a minor imperfection, then they're never going to be happy no matter what we do.
Got you.
And in fact, to an extent, that's the definition of body dysmorphia.
Got you.
But you can work on body dysmorphia. And
can you?
But yeah, you can.
And there are some people that I've seen who've been diagnosed with body dysmorphia, but I know they've got facial disproportion.
How do you
that's what
feel
I'm
like,
saying.
how? Because when I come across people that have body dysmorphia, firstly, they don't know they have it. Yeah, they never know they have it.
Really?
Yeah, so even if you do give... I don't think there's anything wrong with enhancements. I feel like if it makes you feel better and it's something you want to do, go ahead and do it.
And that's why I feel so individual. It's so, and that's why I was going back to the influence thing. That's why I say it's so individual when it comes to like what you want to have done. It's for you. Like it's something that you've seen and you want to change.
But it's not always for you. It's like
majority of the time, or it should be.
Yes, it should. It definitely should be. And speaking to you especially, and you, I feel like we're really being enlightened about the ethical practices and how you guys are saying how it's important to make sure that the individual, the client, has a sane mind and is coming at it from a right point of view. You know what I'm trying to say.
Do you think there's a perception? Sorry. Do you think there's a perception of us being in an unethical industry? Is that what you're saying?
Yes. I feel like I'm just going to come out and say
so much in the UK because we're actually governed, have rules and regulation, but abroad, definitely.
Yeah, definitely. I came here today under what I personally feel like people should be able to have cosmetic surgery and change themselves however they want, but I don't necessarily feel like it's a good thing because fundamentally people are changing themselves from a place of insecurity, and I feel like we should try and develop ourselves internally before changing our external appearance. But of course, if you need to have corrective surgery or normalise yourself, if you have a deformity, for instance, and you literally can't live with it because
there are 4 types of people that come for cosmetic interventions. One is normalization, one is beautification, one is aged gracefully, and one is transformation. So there are 4 types of people that come.
What's the transformation?
Transformation, we tend not to see that in the UK so much. It's often seen in the Far East, actually, where people want to change their facial appearance from something that looks Far Eastern to something that looks more Western. And transformation of people's appearances is probably something that we don't really have so much experience of in the UK.
Yeah, I think that is really sad. How, I think perhaps it's Korea. I feel like it's one of the plastic surgery capitals of the world.
Right.
Is it?
No, they're really good for skincare.
Is it?
Yeah, that's what I thought.
They're really good.
I'm a member of the International Society of Aesthetic Plastic Surgeons. And that organisation produces its worldwide figures, and I'm not sure which country tops it and which country is second. I think Brazil is number 1.
Yeah.
I think the USA and Korea are about number 2 or 3, and Britain's down there, number 10 or something like that.
But those countries where it's almost expected. It's almost like a coming of age to get your nose done in certain
I'm not sure
countries.
if that is the case. I think that's a perception which I think is...
It's a perception, of course. I'm not saying that it's
flawed,
something
and I'm not sure if it's completely accurate.
I'm not
particularly because we're talking about people in the Far East, and I'm saying myself, I have no knowledge of what happens in the Far East, but if you have... if you have knowledge and experience of that, then clearly I bow down to that greater knowledge.
There is a perception that when you get to a certain age, then if you have the money, then you change a certain thing about yourself. And I watched a documentary about Korea, how if you're not attractive, then sometimes you're unemployable.
Well, I think that's the case with people in all countries, actually. And I think if you look at social science research, there's enough research looking into attractiveness and professional success, and I don't think that's just something that's the case in Korea. It's the case throughout the world.
True.
But where does this end then?
Well, you have to change society if you want to change if you want to change the correlation between attractiveness and high success and professionalism. You have to change society.
That's what some people might associate that with plastic surgery as well. If they don't look as good, and sometimes they do get enhancements in order to succeed in their field. That's another reason that pushes people in order to go and get cosmetic surgery.
I remember seeing someone who said, I want to change my appearance, And he said to me, I'm already very successful in what I do. And he was telling me about how he ran so many businesses and he was the leader of that business. And he said, in order for me to maintain my position, my highly successful position, I feel I need to look my best. And so we had a discussion about what we could achieve for him based on him looking his best. And but to be honest, for millennia, we've all been wanting to look our best. And it's something that's gone on for centuries and centuries and centuries. Going back to Cleopatra, she used to have a bath in ass's milk, which is the original chemical peel, isn't it? And from then onwards, we've always done things to try and make us look and feel our best. And these days, with coronavirus going on, you know, not that I go to the hairdressers, but so many of my friends have been saying, you know, I can't get to the hairdressers, I can't get to my beauticians, I can't look my best, and I just can't wait for the day when I can get my hair done, when I can go out, when I can just socialize with my friends, when I can feel good about myself. And it's just been something that's happening for years and years, and no one's going to stop it. We're always going to be wanting to look our best and feel our best about ourselves. And if people want to get a bit of work done so that they can look and feel the best about themselves, I don't see anything wrong with it.
You don't agree?
I do agree, because I mean, look, I like doing my hair, I like doing my makeup, I like looking nice, but also, if other people weren't getting it done, then would someone get it done?
Yeah,
because I think you're not in competition with other people. You're in competition with yourself. You want to be your best.
You want to be
You don't want to be better than someone else.
But
and you don't want to push them out of the way. You don't want to be toxically competitive to get to the top
I
by
agree.
pushing someone else out of the way.
I agree, but you automatically put yourself up against someone else in order to understand where you are,
Not
to
really.
figure out your
Sometimes
best.
you put it up against your
No,
own
because
self.
if you were the only person in the world, then you wouldn't be thinking about your appearance.
Yes, I would, because if the same when I talked about my boobs, I had my son, and my boobs were not perky anymore. They weren't the same. And
Yeah, but
I'm
you wouldn't be
I need to get
comparing
them
yourself
done.
to other people.
I was comparing it to myself, my past self.
Yeah, but you would
so
just
now-
but that's just aging is a natural progression.
Yeah,
in
but
life.
that's still something that I would say if I did do it. It was because I wanted my boobs back, those boobs back, not these boobs, those ones back. You know, so it's not me It wouldn't be me comparing it to anybody else but myself. So it's not always the case, I think, and that's why I think it's important to have knowledge of self and maybe not seek, especially when you're doing something as big as surgery and injectables or whatever the case is. It should be your own choice.
But don't you think that you're just trying to cling to this ideal of youth, which, like, it's just
No.
I feel like
It's-
your
it's-
body changing when you have a baby is completely different to aging.
Yeah.
Because I've got 2 kids myself, and again, the whole boob thing.
Yeah,
I
it's
still
like,
think
what is-
about it because my boobs are completely
Like,
different.
these ain't my boobs. Whose are these?
Completely different.
But they
So-
are.
Yeah, well, I know, but the
They're
thing
not.
is, when you have a child, you're so used to your body one way.
Yeah.
Then you have a child and your body change goes this way. Then you might have, and then you have another child and your body's like this way. And I'm like, don't get me wrong, I had pros and there's cons. Like with me, every child I got bigger hips. I was like, well, this is all right. But then the boob was like, oh, this ain't cool. But that's for me. So it's just
But that's just your interpretation of your body. There's
No,
nothing wrong.
it's
Like,
not
by the way, I don't know what I'm going to be like after I have children. I might decide that I want to get my boobs done.
Come back
I don't
to
know,
me
but
then.
I'm just talking about why we do things.
Yeah, we do it because we want to be our best self.
Yeah.
And being your best self is, well, we should do it because we want to be our best self.
Yeah.
Not because we've seen somebody else do it and we want to just follow them and look like them. But you want to be your best self.
But if every woman, after she had a baby, if she just accepted that was the way that she looked, and men also accepted it.
Men
and
do accept it. Men love,
Some
some men
men-
love
some men
it.
do,
No,
some men don't.
some men love it. Some men absolutely, like, I prefer this body better than I prefer the last body.
But if every
you
woman just
still-
accepted that, then they wouldn't be thinking about trying to be their old self, because they would just
I think you should
understand.
come back after you had a baby.
Pardon?
Come back after
I'm
you
just
had a baby.
we're just talking about it now.
Because I
We're
think
just-
you have a different perception when you've been in that position, I think. Most women that have had, if you speak to like women that have had babies, of course you accept it. Like I'm saying, I didn't get my boobs done because I accepted it. I put on weight, they filled out more, and I was like, okay, this ain't bad. But you do accept it, but that's why it's important to give yourself time. I think it's important not to like rush and just do things. Definitely sit on things before you do it and learn to love yourself. All of that is so important. But I think people do accept it.